Hi, it's Lisa here from Smith & Nephew. I'm here to talk you through a short video on how to manage skin tears using the STAR pathway available from Smith & Nephew. Skin tears are traumatic wounds caused by mechanical forces, including removal of adhesives. Severity may vary by depth, not extending through to the subcutaneous layer. Skin tears may result from a variety of mechanical forces, such as shearing or frictional forces, including blunt trauma, falls, poor handling, equipment injuries, or removal of adherent dressings. In already fragile or vulnerable skin, less force is required to cause a traumatic injury, meaning the incidence of skin tears is often increased. They can occur anywhere on the body, however they are more common on the extremities, including the upper extremities in particular. Comorbidities in combination with aged skin can place an individual at an increased risk of infection, resulting in complications and a delay in wound healing. Starting the appropriate treatment as soon as possible improves patient outcomes. Therefore, patients and caregivers should be educated to perform first aid when a skin tear occurs, in order to preserve the viability of the skin flap wherever possible. Control any bleeding, apply pressure and elevate the limb if appropriate. Cleanse if necessary as per your local protocols. Gently remove any debris or hematoma that may still be present and gently pat the surrounding skin dry to avoid any further injury. If there is a viable skin flap present, realign this by easing the flap back into place using a gloved finger or cotton tip without stretching the skin. A viable flap may not cover the entire wound bed, but should be positioned to cover as much as possible. Carry out a holistic health assessment looking at factors which may affect wound healing, such as diabetes and nutritional issues. Assess the surrounding skin for any fragility, any swelling, discoloration or bruising. Select an appropriate dressing that will create a moist wound healing environment while also protecting fragile skin from further injury. It is vital that the dressing chosen will optimise wound healing and not increase the risk of further skin damage. On the top of the dressing, draw an arrow in the direction of the skin flap to indicate which way to remove the dressing, and make sure this is clearly explained within the notes, adding the date for reference. Consider using a skin barrier product to protect surrounding skin. Reassess after 5 days unless there are signs and symptoms of infection, if there are any concerns or if the dressing needs changing. Signs and symptoms of infection can include increased pain and exudate, erythema, heat and malodor. Wound infection can result in pain and delayed healing. Inflammation from the initial trauma should be distinguished from wound infection. Take time to remove the dressing slowly. Remove the dressing in the direction of the arrow to protect the skin flap. Monitor for any changes to the wound and exudate levels. Determine the date of the next wound review and dressing change and document all assessments. Use an emollient to soften and smooth wider skin area and prevent further tears. Iodine-based dressings. Iodine causes drying of the wound and periskin area. A major risk factor for skin tear development is dry skin. Iodine-based products should not be used for the management of skin tears or for those who are deemed at risk of skin tears. Skin closure strips. Expert opinions suggest that adhesive strips are no longer a preferred treatment option or choice for skin tears. Thank you.